I'm daddy. Miniska, we go to but I'm a planning. I know what I could do more routine. I have me. Dima Tem and come put in Bona Baba Kame. Boka, my Sam, the Viaminte. Mene, Opa, I'll say, I'm focused. I'm focused. Because I'm
99.7 FM.
And nothing. I'll be both and then I'm at it. They say my song be a
family there.
Dedicated
Dedicated to my ultimate health family. Yeah, not just a frequency 99.7, but also a family and a promise. And not just a program. So tell a friend to tell a friend. Nortey by Nature is on. And we call it Ultimate Health on Joy 99.7 FM. All right, you know what I'm talking about. Bedwetting. Yeah, we kind of tied up, done with Ghana month.
You know he's another OP.
And you know I've been doing an extended session with the University of Ghana Medical School celebrating its 60th anniversary. I've brought yet another product into the studio. Dr. Frank Osusetre, consultant pediatrician. He's the head of the Rebecca Akufuado Pediatric Intensive Care Unit, PICU, at the Kolebu Teaching Hospital. And we're going to take it drip by drip. Yes, bedwetting. What is it? Why is your child bedwetting? Have they ever been dry or never been dry? What are the causes? Different types. And more importantly, what can we do about it? Is there a basis for the, should I call it traditional, crude, draconian naming, shaming, punishment? You carry your mattress and your beddings through the neighborhood and they give you all kinds of names and stuff like that. If you have any experiences, concerns, you can share with me. WhatsApp is 05511119997. We're live on Facebook and YouTube. Nocturnal Bedwetting. Doc, you're welcome.
Thank you.
Right, great to have you, Dr. Frank Osusetre, University of Ghana Medical School, year of 2002. It looks like all the doctors I've featured were from your year group. I haven't been fair, right?
Oh, no, I think you've been fair. That year group marked the turning point of the brain drain.
All right.
We were the year group that decided to start
stay.
Staying.
Right.
And that's how come we seem to be all over.
Right. I've had you. I've had Dr. Jifade. I've had
Calistego.
Calistego has been here. We've
Boyema.
had Vincent Boyema, right? And many more. But we've wrapped up. It's been an awesome anniversary. Were you part of those going footloose and fancy free at the luncheon?
Unfortunately,
you
I
missed
couldn't
that.
make it because
right.
I had another engagement.
All right. I've seen people sharing the video and for different reasons. But you're most welcome.
Thank you.
Right.
Thanks
Very, unfortunately, very common, right? Seems to be more common in males than females, right? But let's hit it on the head. What is bedwetting? Or enuresis?
Yes. The proper name, scientific I may say, is called enuresis.
Right.
And basically means somebody passing urine at night.
Okay.
Involuntarily.
Okay.
Not that the person has woken up.
You know nothing about it.
To go. Yeah.
Right. It's not conscious.
And it is done, or it is said to be a problem beyond a certain age because, naturally, if you look at the developmental basis of people, when you are born, you pass urine and stool as and when. In fact, for babies, whenever they feed, they pass stool or urine, and that is a well-known reflex.
Right.
And as they grow, we expect that to change. And the changing, the development, everything is controlled by the brain. Okay. So we expect that at a certain point to the ability of the person to now be able to ease him or herself appropriately will also be determined by the brain.
Okay.
It is when that is not happening at the age that we expect, that is when we say the person has got enuresis, especially when it comes to passing urine alone.
So we're expecting you to build capacities as you grow and, of course, as your brain, your nervous system develops, right?
Absolutely.
We're expecting that you will acquire and achieve the ability, the capacity to control your bladder, and the other one on the other side, your sphincter, when it comes to feces, right?
Yes.
So you learn to download in particular places at particular times, right? And this is a capacity we mark actually as a milestone.
Yes.
So doctors do ask you, when did your child crawl, sit, do all this thing, and then when were they dry? So that suggests to me, Dr. Osusetre, that there is a cutoff point at which we would expect the average child, all things being equal, to have acquired or achieved this bladder control in this circumstance that we're discussing.
Yes,
is
please.
there a marker for that? So that the reason I'm asking this also is because a lot of pressure is placed on children, right? Toilet training is a major trauma, but also a major milestone, right? And there are different ways of toilet training a child. But at what point do we expect the average typical child to have acquired this capacity?
Usually the books will say 4, 5, but we can stretch it to 6.
Okay.
So by 6 years, when children are going to class 1,
Right.
They should be able to control their ability to pass urine, especially in the night when they sleep.
Right.
Interestingly, they tend to be able to control that during the day, and that is not a problem. It is the night one that a lot of children tend to have some issues with, and I believe we are going to delve a bit deeper into it.
All right. So, Dr. Osusetre, for the benefit of my listeners, I mean, if my child is 3, right, and comparatively or compared to his older sibling, Chale Achekakra, I mean, there's some delay. What we're saying clinically or diagnostically is that before this cutoff, maybe age 5 or a bit older,
to 6,
yes. Right?
Yeah,
it shouldn't be a problem.
Yes.
And you're suggesting that the parent should not be worried or stressing this child.
Yes, especially so when it comes to comparison. Every child develops differently. Be it a boy or girl. Boys are notorious for achieving that nighttime continence later compared to girls.
All right.
But parents maybe they have 2 girls. One was able to keep the night dry at 3, and so they expect the other one to also be able to do that. Until we have crossed that line where we think that now the age is appropriate or inappropriate for you not to be able to keep dry at night, we shouldn't worry. We shouldn't worry. It may be undue, inordinate, excessive, and it may be exerting a lot of pressure on this poor, unfortunate child. My consultant pediatrician suggests that, well, there's a developmental process. And it unfolds in stages, right? So beyond a certain age, you would not want to put pressure on this child. And he also underscores individual differences in the acquisition of these competencies. Share with us on WhatsApp 055 1111 997. This is Ultimate Health on Joy 99.7 FM with me, Nortey Dua. I'm speaking with Dr. Frank Osusetre, consultant pediatrician with the Kolebu Teaching Hospital. He heads the Rebecca Akufo-Addo Pediatric Intensive Care Unit. All right, having said that, and that gives us a kind of a cutoff as to when to see maybe a professional or a doctor. But Doc, let me ask you this. So what is bedwetting in terms of frequency or degree or even amount? The odd occurrence several times a week, several times a month. What is the problem and how do we capture it and diagnose it consistently? So we have something we call the primary and then the secondary. And then we also have the complicated and the uncomplicated.
Right.
So we say it is complicated if there are other things that we see. For example, if the child is also passing stools inappropriately, in addition to bedwetting, then we say there's a problem.
Right.
But if it is just the urine, just passing urine, then not so much of an issue in terms of the number of times you pass at night. You are not supposed to, once you attain that milestone, you are not supposed to be able to pass urine during your sleep. But that said, sometimes some children are not well, and there may be certain issues that may make a child who has attained continence to now pass some urine. That is not a problem. It's the consistency that makes it a worry. So the primary one is a child who hasn't been able to learn to keep dry at night at all.
So they never acquire
irrespective
that
of the
skill,
age.
that capacity.
Precisely.
Right.
Some can go up to 11, 12, 13, and they still can't even keep one night dry.
Right.
And then we have some children that have been able to attain continence. They have learned to be able to control the voiding. And for some strange reasons, 6 months or more after, then they begin to wet bed at night.
Right. So they regress.
Yes, that tells us that there is something happening that we need to go looking into.
Okay.
So that is the secondary cause,
Right.
or the secondary enuresis.
Okay. So again, I want to come back. I didn't quite get it clear. So it's not the number of times you wet, right? I've seen some literature that suggests that at least twice in a month, and so on and so forth. Is that an important criteria to look at?
No, not so much. Every now and then, people get accidents. I believe even some adults wet bed maybe once or twice.
Right.
Not so much of an issue. It is how often, how consistent it is.
Okay.
That makes it an issue.
Okay.
So to put timelines to it is usually problematic. If you don't take care, we're going to lump a lot of children who are just having accidents as bedwetting, when in actual fact, maybe they have urinary tract infection or there's something else that is causing.
All right, 20 minutes past you have 2 on Joy 99.7 FM. The program, as usual, on a Sunday afternoon is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. I'm with Dr. Frank Osu-Setre of the Kolebu Teaching Hospital. We're looking into involuntary voiding or involuntary urination. Nocturnal means at night. Enuresis is the proper terminology, but you might call it bedwetting. If it happens during the day, then it's diurnal, right? It's not nocturnal, right? So as you grow, you're supposed to acquire this capacity, this skill, this ability to hold your urine, especially when you are asleep, right? And therefore semi-conscious. Those who have these challenges are the ones we're talking about. Quite common in our part of the world and other parts of the world as well. As the ages advance, you see that the percentage or the prevalence goes down, meaning that most of us at some point will have mastered this. This one says, "Hi, Nortey. My experience was it starts like a dream, and by the time you open your eyes, you've messed up. You messed yourself up with urine." Okay, the confessions are coming. Henry from Sun City in Agbogba, right? Starts like a dream. I'll ask Doc about this. Good afternoon, Nortey. My 15-year-old daughter still bedwets. Should we see a daughter, Mami, in DC, which I believe is Dansoman? This is Daniel from Akropong, Ekwapim. I am asking, does it only happen to children? I'm told adults do experience this. If it is an adult, what caused it? We'll come to the causes in a sec. Good afternoon. Good topic, Nortey. Where is it? Right. Good afternoon to both of you. Please let me know if I should worry. My just turned 5-year-old boy wasn't wetting the bed at all before 2 years when he passed diaper usage. But once in a while, he pees on the bed like it happened when he woke up this morning. If your resource person can tell me what we should do, I will appreciate it. This is Zet from Akwete Man. So he's just turned 5. Doc will answer some of these. So the dream and, it's like some kind of downloaded dream. You are in a nice, you're in the toilet actually.
It's not just him. I mean, I remember I also wet bed for some time.
Wow.
I think I was able to achieve dryness around 7, 8.
Okay.
And I identify with this dream bit.
Okay.
I mean, you are playing with your friends in your dream, of course, and then you tell them you're going to wee-wee, so they should just wait. Sometimes you're playing football and you just tell them they should wait for you. And by the time you realize
you've scored a goal.
Oh
my goodness.
And for me, I mean, my old boy thought that I was making things up, I mean, because sometimes I say, but you had woken up. And why did you do that again?
All right.
Meanwhile, I probably might have just opened my eyes or so, drifted back to sleep, had that wonderful dream, and then the result is what everybody knew. But so I truly identify with that. And that is the reason why we should be, when it comes to the management, we should be circumspect. We should
Right.
exercise some restraint and then some measure.
Okay.
Because it is not intentional at all.
Okay.
It's not something that the children do, not because they are lazy.
Hence,
or anything.
involuntary
Yeah, it's
urination.
They
It's
have
not
no
something
control
they're
over it.
doing because they are stubborn, resistant.
Or because they want to show parents that,
right.
yeah. But it's not. It's just an
Okay.
accident. That
I'm
happened.
glad you shared your testimony, and I know somebody has asked a 15-year-old who is still bedwetting, what should they do, etc. Right? But let's address this issue of possible causes. We hear that there's an aspect or a chunk of it which is possibly or likely reckoned to be hereditary, right? I don't know whether you asked your dad, but there's some. You asked your dad, but there's some research and some empirical evidence that it does tend to run in families and so on and so forth. Let's take a look at possible causes. The brain controls all of this development, and you mentioned that some things could go wrong there. So
yes. So the brain controls the amount of urine that you make.
Okay.
It produces a certain hormone that will control the amount of urine.
Right.
Once the urine is made, it has to be stored in your bladder.
Okay.
So the size of your bladder also counts.
Right.
And for you to feel the sensation that you want to wee or you want to pass urine, the bladder will have to contract.
Okay.
So these factors are involved. Your ability to train them. For the brain, not that many of us can train our brain not to make or to make urine.
Okay.
But to feel the sensation and to go, we need to control that.
Right.
So if you're able to master that, then you can hold the urine for some time. We know women are very good at holding urine compared to men.
Okay.
So maybe that is how come it is more common in males. But yes, some research suggests a genetic underlining or underpinnings. Like you rightly said, some parents, especially mothers, if a mother has a problem with or had a problem with enuresis,
Right.
chances are that the children may also have that.
Okay.
And classically, it tends to go away or they tend to attain the continence around the time that the parent or the mother or the father, whoever is involved, also attain that continence.
Okay.
So even though no gene has been identified, so to speak, there is evidence to suggest that, yes, there is some genetic predisposition.
Okay.
Maybe research will throw more light on that
Okay.
as we go along.
Right. You mentioned the brain's control of these things, and then the signals that will indicate that you have a full bladder, and the signals that will indicate or should I say initiate the contractions, right? That facilitate voiding and so on and so forth. These are all controlled neurochemically or whatever
Yes.
by the brain.
Yes.
Now, I want to ask you this for the benefit of my listeners. You know, we are created by God, okay? This is the body we came with. Now, civilization and all these other things were add-ons, okay? A chicken will void when it wants to void, right? Maybe a monkey in the wild. This programming, can I consider it the norm such that if I deviate from it, then it is a disease or a disorder? I hope you're getting my point. Were we designed to void consciously and in a controlled manner? Or is it because we are civilized and we wear clothes and underwear and so on? Can you answer that for me?
Well, very difficult for me because I haven't come across that.
Right.
But if you ask my personal opinion, just as a child is born, the child learns to sit at a certain stage. Nobody teaches the child.
Right.
The child learns to crawl at a certain stage, stand, cruise around,
All right.
talk. I think personally that there may be, we must, for us to have that ability to control,
Right.
it means we are programmed at a certain stage to be
Okay.
able to control that.
Right.
So that we don't go doing things,
All over the place.
anyhow. So there must be some aspect of civilization. Of course, society expects you not to mess around, But I also think that naturally we are programmed at a point to be able
We
to
must
hold
control
things.
our
Yeah,
edges
we need to be
and
able to.
impulses. So
Certainly.
it's not that we are rewiring and
No.
reconfiguring God's creation.
No.
This is something that should take place
there.
and unfold in developmental stages.
Yes.
Okay. Right. If you've just joined us, 28 minutes past the hour of 2 on Joy 99.7 FM. My name is Nortey by nature. I'm discussing bedwetting. And, your confessions and testimonies are welcome, right? But it is very common. It is very embarrassing and creates situations in families and for individuals. Some people can't go for sleepovers if they are in that kind of social bracket. Challenges at school or this and that. Siblings have given you a nickname and so on and so forth. Share your experiences with me. I've heard of very, very, very harsh, aversive substances being ground, blended and inserted in a bid to control,
teach you a lesson,
right? Harsh, negative, aversive conditioning, the psychologist will say. Does it work? Does it help? Right? And let's start to understand these things. My guest in the studio, Dr. Frank Owusu-Setre from the University of Ghana Medical School. He's the head of the Rebecca Akufo-Addo Center for the Pediatric Intensive Care Unit in Korle Bu, but more importantly, he's a consultant pediatrician. He deals with the issues of children, and that's why I brought him in here. We had already said that we'll do this drip by drip, so don't worry if we don't exhaust everything. We probably will have him next week to continue. So coming back to these issues, there could be a structural or a functional thing to do with the bladder, its functioning, and so on and so forth. Then you mentioned that there are certain hormones, right, that control how much urine we produce and also are related or connected in a certain way to the urgency to urinate, right? The sensation, the feeling that comes that tells you have to void, right? So could there be also something by way of illnesses and other conditions that could contribute to enuresis?
Yes, certainly. So I think you rightly mentioned that sometimes you may have an abnormality along your genitourinary tract.
Okay.
Like we mentioned, the urine has to be produced somewhere, has to be stored somewhere. So if there is any defect, abnormality, that is impairing either your ability to control or your ability to store, the urine is going to drip.
Okay.
And whether you are day or night, it will come. Anyway.
Right.
So that is one. Then that said, we also have certain conditions like diabetes.
Okay.
We know as part of the symptoms of diabetes, you have to pee a lot more frequently than others. And if you have a child who sleeps deeply, then chances are that child will wet the bed.
Okay.
Not because of anything, but purely because of the amount of urine produced at that particular time.
Right.
And then we also have certain children who may not be able to sense. Everything will be fine, in terms of the brain, the genital tract, and even the spine. One of the common things is if you have abnormalities around your spine, because the nerves that control the bladder are found along the back.
Right.
And then if you have any problem affecting that place, then your ability to be able to control that will be affected.
Right.
We also have certain things such as constipation or pinworm,
Right.
so that when children are constipated, there are certain children that no matter what you do, they won't wee. They will wee only when they want to. And by holding things that way, they instead of weeing before they go to sleep, they go and sleep when their bladder is full, and then they lose control over it, and then they.
Can I just come back to the constipation? I have heard that when you are constipated, then it exerts some pressure on the bladder.
Oh yes,
and
does.
That can also lead to involuntary voiding.
It does, yes. And in addition, you also have to strain in order to pass that. So by straining, then you can. So you imagine a child who is deeply asleep with full rectum, so to speak, exerting pressure.
Right.
Chances are that child will pass urine unconsciously.
Okay.
Yes, and then when that child eventually gets up and wants to do number two, we'll also strain, and then number one will come out.
Okay.
But that will be desirable, though.
Right.
Yes, that will be desirable.
Okay, folks. Go ahead.
Okay, so the other aspect is that if you have a normal anatomy, in other words, your brain is okay, your bladder is okay, everything is okay, and yet you are not able to sense the signals coming from your brain, coming from your bladder, and the rest to act on it on time, then you are going to have these problems.
Okay.
Bedwetting.
All right.
So it is not always the case that you investigate and you find something wrong.
Okay. Right. If you just joined us, 33 minutes past the hour of 2 on Joy 99.7 FM. Interesting discussion, revealing, informing, and hopefully transformative. It should educate you about what you should be doing and what you shouldn't be doing, right? But more importantly, it should be directing you towards the appropriate quarters when it comes to resolving these matters. Some of the kominini that you hear or you've been handed down from some harsh auntie or mother or caretaker, please, this is the place to listen and get yourself informed, whether you run a creche, a kindergarten, a school, you're a parent, a sibling, and so on and so forth. Let's get to understand these things. Shortly, I'll activate the phone lines. We're live on Facebook and YouTube. Ultimate Health, Joy 99.7 FM. My guest in the studio, Dr. Frank Owusu-Sekyere, consultant pediatrician. Now, let me ask this thing. There's some theories, again, that come up that, oh, Charlie, you sleep too deep. When you are gone, you are gone. And that could also be a contributory factor. And then sometimes we hear things about eating too much or drinking too much before sleep. Are these also possible related factors, if I can't call them causes?
Yes, they are, especially when it comes to the deep sleepers. There are some people that you will wake, and they will not simply just not wake. So if even with effort, they are not waking up, then it becomes difficult. They themselves waking up to go and attend to this call when it happens. Right. So that is real.
So this is related to sleep stages, sleep cycles.
Yes.
That you spend too long in deep sleep.
Deep sleep.
Right.
Yes. Some children, naturally, as soon as they lie down, they are gone. No matter what you do, they're not going to wake up. So it has an effect on maybe when we come to management.
Right.
One of the things that we want to do is to be able to get them to go and read themselves.
Right.
So all conditioning their brain.
Right.
And that becomes a very topical issue when it comes to deep sleepers. And yes, if you drink a lot of fluids, fizzy drinks, all things, we all know caffeine and the rest, they exert, we call it diuresis or diuretic effect. So you take them maybe before you go and sleep or maybe midday thereabout. The effect is still on. Chances are that you're going to produce a lot more urine. And if you are not able to wake up to go and read, then you are going to wet your bed. So what you eat, what you drink is also important, especially around your bedtime.
All right, folks. 36 minutes past the hour of 2, and I am the counsel for the accused. Yes. Anybody who has been accused of bedwetting, I present the case. The defense, right? This is what we're learning. There's a whole neurochemical setup, right? That's controlling all of these things. There's a brain, there's a central nervous system. Anything can go wrong there for your child, okay? Plus, there's something that is inherited. Hey, maybe you passed it down. Yes, they downloaded the software and installed it, okay? And then, of course, there are other stressors and triggers that we're tracing with the help of Dr. Owusu-Sekyere. Let's get to understand them. I know you're sending me stuff, right? I did get the question about the 15-year-old. We look at the parameters. By 6, most children, it doesn't mean every child, right? And therefore, it does not mean your child should, right? So we've gotten to understand all those. We'll be moving forward. Let me read a couple of messages, Doc, and see if you can help me with responses. This one says, you guys, I really need to pee, and I'm 20 minutes from home. The more you talk about it, the more I want to pee. Abigail Forson from Ashaiman. Abigail, all right. You talk to me after we peed.
I think hers would not be classified as Enuresis.
This is daytime.
It will be daytime, and that's worse.
You know what you went to drink, but I do hope you get to do it in the right place. A friend of mine once told me he carries a bottle in his car, but that one is elder matter. We'll get to talk about that as well when it happens to adults. Hello, good afternoon, Nortey Dua and Ultimate Health Team. Please kindly ask your guest if bedwetting does have some spiritual causes or it's just a myth. Why do I suspect this is Ajiman Joseph, but there's no name? Okay, right? Spiritual. Do you work in those realms?
No, unfortunately.
Parapsychology and all that?
No, unfortunately. So I'll stick with the medical courses.
All right. This is...
but I don't believe there is a spiritual aspect to that.
Okay. Hello, Nortey. Blessed Sunday. This is Oye in Afenya. Oye, Blessings to you as well. Download the blessings and install. God is good all the time. I was hoping you're going to share your testimony, but 055 11 11 997. That's where we do the business, Ultimate Health. Shortly, I will activate the phone line. So we've done all of these. This suggests to me, Doc, before you hand down that diagnosis to a parent, right, for a specific presentation or case, then this means you must be doing a whole load of assessment and investigation. Because the kind of things and systems we talked about, it could be an infection, it could be diabetes, it could be this, it could be that. That suggests a very intricate and complex assessment.
Well, not necessarily. If you follow, if it is just primary enuresis,
all right. Primary meaning that the child never
attained
was
continence.
dry. Yeah.
Yes.
Okay.
Up to 5-6 years, you're not going to do anything because a lot of children will do that.
Okay.
And then it is after that you want to make sure that there is no diabetes or urinary tract infection.
Okay.
But you cannot have urinary tract infection throughout your life.
Right.
You know?
Okay.
So that rules out certain investigations you are likely to do.
Okay.
It is the secondary one.
Right.
Where somebody who has attained continence is okay.
They were fine.
And then suddenly starts. And it goes on for some time. That is when you want to make sure everything is fine.
Okay.
And because of the debilitating effect, the psychological, the social aspect of that, you want to make sure that if there is anything that you need to pick and then maybe treat, you do so that everybody is okay.
Okay.
But it does not mean you are going to do, for example, an assay of hormones to see whether your antidiuretic hormone is working or not. No, we don't do those.
Okay.
We don't. So it's just a very simple investigation, an ultrasound scan of the kidney, bladder, and then the urinary tract.
Okay.
And then sometimes just an X-ray just to make sure everything is okay. Then you analyze the urine, you do the blood for diabetes and others. If there is nothing, then you just know that even though the person has attained, there's a secondary aspect of it. You probably should be looking at the family dynamics, whether there is anything going on in there that is making the child regress. So to speak.
Right, I'm going to activate my phone line 0302216541. We're learning, we're growing, we're being informed, and indeed being ultimately transformed. We're learning about bedwetting, nocturnal enuresis, involuntary urination, right? Big problem. But there are solutions, but we're taking our time and building. We want to make sure the bladder is full before we release, right? That's what Dr. Uswansa advised. And hey, who am I? I take his advice, doctor's orders, all right? But you can send your questions and concerns. So we have this assessment, then this can be done. Let's address this issue. So listening to us, many parents, many families, many of the afflicted. So when do you go to a doctor? When should you go to a doctor? And which doctor should you be going to? Your regular GP, family physician, or are you supposed to look for a specialist?
So as a cutoff, whether primary or secondary, I would say that if the child is 7 years and still bedwetting,
okay,
you should see a doctor.
Right.
Now, because the basic laboratory investigations that we do are not so specialized, you can't see a general practitioner to troubleshoot, to do the examination, run the test, and see if there is anything we need to pick. For example, if it comes out that you have diabetes, then you will be referred. But if it is urinary tract infection, the general practitioner can't treat that.
All right.
And if he's able to resolve it, that is fine.
Okay.
There's another thing that we should always pay attention, especially when it comes to the secondary one, that we have certain types of worms that will cause intense itching, so that the children void in their sleep. So that's a very important cause in the secondary cause of enuresis.
Right.
So if it is that, you give a dewormer, the child is fine.
Okay.
So it is when it becomes persistent, and because of the multidisciplinary nature of its management, that is where you refer to a specialist or maybe a pediatrician for a comprehensive management of the case.
Okay, great. My phone line is active, 0302216541. Those are the healthy buttons to push to void on a voluntary basis. Void with regard to your questions, all right? And WhatsApp is still active, 055 11 11 997. I can see that, hey, there's a lot of action there. So we've got an understanding of what it is, how it's diagnosed. We've understood that developmentally, stressing a child below the age of 5 or even 6 is unfortunate, right? And there's still room for that child to master this skill or competency, right? So be mindful of that, right? And it can be primary, meaning that your child never mastered it, right? Or they mastered it, things were fine, and then they slipped
about
back.
6 months, a period of 6 months,
Right?
and then
Yeah. And
regressed.
then they regressed and then they lost their control. Sometimes there are psychological and other traumatic stresses in the child's life. All of these are assessed and addressed. But the more important thing is to know that by its terminology and nomenclature, involuntary is the key. So your child is not being stubborn, difficult, and intentionally doing it to get at you, right? And the more important thing is to understand this and seek help in the appropriate places.
Absolutely.
Yep. Let me read a couple of these. Good morning, Nortey. My daughter went through bedwetting until she completed JHS. It was a big worry to us. She couldn't visit places. I never reminded her of it because she was herself already worried. She's fine now and in her medical school, 4th year. Great. Thumbs up. I'll come to that, Doc. There's a lot of evidence that many also resolve on their own without any attention, so long as they are not being stressed about it. Many recover and it goes away. Somebody wants to know how to get Able-wide tickets. I believe they have a portal where you can get that. I have a caller on the line. Hello.
Hello, good afternoon, Ate.
Yeah, good afternoon. Who am I speaking to?
Please, this is Rukaya.
Rukaya, how are you?
By grace, I'm blessed.
Right.
Yourself?
Not bad. I'm blessed too. You have a question,
good.
experience, or?
Yes. At least listening to you, now I know that I've really worried my child. Now, my child is 7 years. But right from childhood, I noticed he was being on bed. And it got me so furious. See, there are times I resort to, they call it,
Mm-hmm.
you get it? Because I was like, why can't he get up and wee-wee? You get it? And sometimes you didn't wake him up to wee-wee, but the next minute, he's done it on the bed. It took me time. I sort of had to psych him, talk to him. And then eventually he has stopped. At least for some time, I've not seen him do it again. Usually he will keep it, so the moment he wakes up first and he goes to wee-wee. Please, is it bad? Because when he's wee-weeing in the morning, he's struggling to bring it out. I don't know because of what I've done to him always. Yes.
Okay. Thanks for sharing, Rukaya. And Abeku and I have our own kakadro for you. Now that you have repented. But she's talking about a very traumatic process where she's been very harsh on her son. And now listening to her, she's worrying whether she did the right thing. He has some difficulty when he's voiding now. Even consciously, and she's wondering whether she's done something that could have resulted in this. Let me take another caller and then I'll let you respond to that. I've got this caller on the line. Hello? Hello? Nope, I don't have a caller. Okay. Hello, Nortey. Charlotte here. Please inform Doc that Mrs. Sybil Owusu-Setre is listening with the kids. She expected to see it live on Joy Prime. We're on Joy Facebook and YouTube, right? So go to our Facebook page. You see, is that your wife?
That's my wife.
Hey, no Ben, no Kev. Please, Abeku, make sure that it is beaming live. Mrs. Sybil Owusu-Setre is listening with the kids. And they want to see Daddy live. Daddy. So Rukaya is sharing that she's done what we usually download before internet and all these Google store. Parents knew what to download, and it wasn't funny, right? So Kakadro and all this, her son, it's been a challenge, and she's asking these questions. What do you have to say to her?
I mean, if anybody doubted the relevance of this topic, I think Rukaya has come to tell us that this is really interesting because of what she did. And now, without anything, she knows that she probably was very harsh. Not that she probably was, she was harsh. And that, in a way, could have conditioned the child's mind in such a way that even now passing consciously or voluntarily becomes an issue.
You're in his
because
trouble.
he's not very sure whether
Yeah.
it is going to attract, those
Right. More
punishment
kakadro,
or
yeah.
not. I suspect that is where
He's a bit
Nortey,
traumatized.
your specialty becomes very
Yeah.
relevant. Probably would need.
We'll talk about
a
that
bit
when we
of,
get to
talk
management,
to.
right?
Yes.
But yes, even toilet training on a regular basis is quite traumatic. Those of you who've read a bit of psychology or read, you'll see that Freud talks about the challenges, and indeed many of the developmental psychologists talk about this trauma that we go through. We download Hotmail as and when we please. And then suddenly there's all sorts of pressure and sanctions, and it can lead to secondary psychological issues. Right, so that's what Dr. Usu is talking about. We'll get to that when we start looking at interventions. Good afternoon, Nortey and Ultimate Health. Please ask your guest if bedwetting. Oh, the spiritual one, right? We didn't. Well, you answered that. You said you didn't believe in it, but somebody is asking why bedwetting is the only dream that comes true. Chai, of all the dreams, when you dream the hottest girl in class is your girlfriend, it doesn't come true. You dream you are a millionaire, it doesn't come. But you dream you are peeing, pam, and it happens. You are the pediatrician. Are you selective in dream actualization?
I don't think so. I think it depends on the stage of sleep that happens. You know, the stage that dreams happen and the stage that nightmares happen.
Right. Okay.
I think thinking about the nicest girl in the rest is actually happening when you have that nightmare stage.
Right. Okay. So we've understood some of these things, and people are looking to see what to do. Right. So you have a child. It's more common in males. We've talked about that. We've talked about primary, secondary, right? We talked about neurochemicals or hormones and all that. Now, when you bring this problem, a lot has gone down already at home, right? But you're now bringing the problem to a professional. What are the immediate things that can be done for your child?
So for us as medical practitioners or maybe specialists, the first thing we'll do is that we'll talk to parents. We'll try to find out at what stage, or is there anything that brings it on? Is there anything that worsens, or
are there triggers? Are there specific times? So what's the profile of the problem?
Precisely.
Right.
So that's what we call history. And then we'll do a physical examination of the child.
Okay.
Sometimes, just by finding a certain dimple somewhere, maybe at the back, it may tell you that this child has a problem with the spine, and so that may be causing that.
Okay.
So if everything is fine, that is when we resort to the few investigations that we've talked about. And then we can settle on what needs to be done.
Okay.
I think a lot of time when people come to the hospital, they expect to be given medications. But this is one condition that we are very, very reserved when it comes to medications. And I believe when we get to management, we will espouse.
Let me ask you this. Let's say I'm 5'6" already. I've been through some aggro, as the UK folk will say, some tough times at home on account of this problem, right? So it's a problem for me as well. Just that I don't share the problem statement or the management. Are you, as a pediatrician, required to do some kind of UN peacekeeping between mom and dad and the child, and set a conducive environment for the subsequent management of this?
Yes. For us, there are certain basic things that we can say to parents. Like one, it's not intentional.
Okay.
Like, we need to make that clear. And then also how you even treat the child.
Right.
This is not something that you call the child in front of everybody and you are chastising the child because the child wet the bed.
Okay.
Or like you said, you have to carry it along the street for everybody to know that this is what you've done.
Secondary school cry is wild.
Yes. Yes. So that is, and we have to let the parents set the record that even if you want to talk about this, it has to be just between the two of you.
And it must be sensitive about it.
It is not
empathetic, right?
It's not something that, it's like the child is doing it intentionally. It is involuntary, like we've said.
Right.
So you just have to make sure that you set that stage. And sometimes with that alone, the children are able to come around. They know that parents are worried. They also know that they are worried. And with that alone, it becomes
So they become stakeholders.
a collective effort. Yes,
I'm doing it for me,
precisely.
not because of mommy or daddy, right?
Yes, and they're able to help themselves at that stage
And partner you
precisely
in searching for the solution and then staying on track and being compliant with whatever is recommended by the specialist or the professional.
Yes.
Okay. This one says from Grandma Lydia Agbeka to my princess Petrine Kutonu of SDA Preparatory Primary School, Akusumbo. She's 8 years today. We love her and wishing her all the best. So, happy birthday to you, Petrine Kutonu of SDA Preparatory Primary School. When I saw the 8 years, I was hoping against all hope that you were not going to say she's bedwetting, right? This is from Dede in Maryland. Hello. A friend's kid was bedwetting and later was diagnosed with ADHD. And that was the cause of the bedwetting. It's a contribution, but it turns into a question as well.
Okay.
The linkage and the association. Sometimes we say comorbidities.
Precisely.
Are they related? Attention deficit hyperactivity disorder and bedwetting.
Yes, because you can't pay attention to these things, so then anything goes. You know?
Right.
So that is well known.
Okay. Sometimes we find these correlations and people want to understand.
Yeah.
Sometimes the correlation is moved into causation, and that's where it gets a bit tighter. The proof needed for those ones is a bit tougher. This one says, please note, my girl is 8 years old, still wee-wees on the bed. Is it a medical issue? Well, we've identified that, but it needs investigation and proper assessment. This is from Lydia in Akosombo. So yes, it is an issue, but approach it with sensitivity.
Precisely.
And then, let's see. I'm sure in any of your facilities, Akosombo, there's the VRA hospital there. You should go there and see a doctor there and see to the assessment and investigations, and be nice to your 8-year-old. Okay, she didn't go buy this or download this from a platform. 55 minutes. We have about 5 minutes. We have undertaken. Next week we'll go into the management. Okay. There's what we call pharmacological or drug management. There's non-pharmacological management. We'll break all that down and we'll tell you which one works, right? There are some interventions that work, but as soon as you take away the intervention, you have a resurgence of the problem. We'll break that down next week, right? Full beddings next week, right? Forgot to spell out ADHD. Yeah, that's right, Dede. We're spot on and we're right with you. Thanks for always tuning in from Maryland in the US of A, where there is also bedwetting. Right, Doc, so we've understood these things. What about schools? Schooling is a setup, right? You move from being yourself and then you start formal education. And there's a lot of pressure for conformity and compliance. Can we put Enuresis in this, as we wrap up? Teachers, caregivers, and so on, how should they handle this? Even though we are talking about Nocturnal, right? It does also affect the child. And should parents let their school know that we are battling with this? Because sometimes it interferes with your own self-esteem, academic performance, and so on and so forth.
Yeah, chicken and egg. Ideally, if you have teachers who understand the nitty-gritty of Enuresis,
right,
then you can tell them and you are sure that they are going to be empathetic and they are going to help, with the management. But if doing that is going to lead to everybody knowing about it, then it's going to be counterproductive.
Right.
So if teachers are trained to understand that, yes, these are developmental issues, and let's face it, teachers are very much involved in the developmental assessment and aspect of children.
That's right.
Especially the preschools right up. So if they understand, then they can become a very big stakeholders in making sure that we get this right.
Okay.
But ideally, yes, teachers should be informed because like we've rightly mentioned, if you are getting these fizzy drinks around daytime, midday, 2 p.m., the effect is going to last longer and then chances are that you are going to wet your bed because the caffeine is going to last for some time.
Okay.
So if teachers are aware, then they probably may be able to help control consumption of these so that they become
and also monitor your child.
Yes, and monitor as
and
well.
Specifically also the preschools, they actually undertake a lot of the toilet training.
Oh, yes.
Right? You go drop your child there, but hey, if your methods are different from theirs, there's conflict.
Yes.
And the child in themselves is in conflict as to how to do this, when to do it. This one is harsh, this one is not harsh, and so on. So it's important we bring them to the table.
Yes.
Right.
And one of the things is that if the children are not comfortable with the toilet facilities in school, chances are that they will hold it and then they come and download. Once they hold it for that long, about 6, 7, 8 hours that they are in school, they hold it. When they come home, they can hold it and then download it when they go to sleep.
Right.
So we need the teachers to be part of the stakeholders to make
Right.
sure.
Great stuff. Teachers, and if you own a school, start this conversation with parents and teachers. PTA is actually a partnership. It's not opposition versus minority. Okay. Indeed, when you shift the words, the letters, and you add something, you see that parents can be made into partners. Right? So let's understand that. And then you can also partner as stakeholders to give the pediatrician correct and valid information about what is happening to the child and the circumstances surrounding what is happening. Right? Because when you are doing the history taking and all that, you want relevant information. Okay, yes. So let's get that straight. Happy Sunday, Nortey and Doc. Thanks for the education. Hearing you guys this afternoon, we've learned so much on how to handle such children. This is from Linda in Osu. Linda, I know you are spot on, but share the message. Hi, this is Charlotte again. I had an uncle who was bedwetting even when he was in sixth form. He was very hyperactive, but a brilliant chap at school. He developed psychotic alcohol dependency, I guess, later in adult life. Any relationship, there's a combination, but we need to understand the time relationships between these things, right? But we look at these things and history is taken, right? Yeah. When you make a blanket statement, then people say, this and that. Doc, anything you want to say to that?
Chances are that it wasn't managed very well. Yeah. And that is the reason why we had that later complications. Okie dokie.
Right. These things have to be managed properly. And Dr. Frank Owusu-Setre, thank you so much. He has undertaken to be here on Sunday next week so that we do interventions and we take our time. I know that is where the anxiety is. So many thanks once again, Dr. Frank Owusu-Setre of the Kolebu Teaching Hospital, head of the Rebecca Akufo-Addo Pediatric Intensive Care Unit. He's been taking us through the fundamentals when it comes to bedwetting or nocturnal enuresis. Okay, we'll come back next week and we'll look at the solutions. Many thanks for tuning in and sticking with me, Nortey by Nature, and my producer Abeku Kofi. Next, I go over to Bile, who brings us Sunday Rhythm. Stick and stay. Don't go away. I hope you've been informed and transformed. I'm out.